People with diabetes are at great risk for end-stage renal disease. A new research project at Joslin Diabetes Center, funded by a $25 million NIH grant, will look for new ways to prevent this.
The aim is to see whether by decreasing uric acid in people who are at risk of kidney complications really can slow down or even halt their progression to chronic kidney disease and to end-stage renal disease.
This 8-center clinical study will be led by Joslin's Dr. Alessandro Doria and the University of Minnesota's Dr. Michael Maurer. Other sites include Colorado, Michigan, Chicago, New York, Toronto, Canada, and Copenhagen, Denmark.
The group is actually called PEARL, which is Preventing Early Renal Loss in Diabetes. The current estimates suggest that about 10 to 15% of people with diabetes develop end-stage renal disease, meaning that they need either a renal transplant or they need a hemodialysis to survive. We need additional intervention that act together, good glycemic control, trying to curb diabetic complications.
The 3-year trial of approximately 500 people will test if a generic drug called allopurinol will reduce the occurrence of kidney disease in people with type 1 diabetes. Allopurinol has already been shown to reduce uric acid levels and has been on the market since the 1960s as a treatment for gout.
We performed a fairly large study here at the Joslin. This was done actually together with Andrzej Królewski in the same section where I work. And basically what we did was to follow a group of people with type 1 diabetes for several years, and what we saw was that the levels of uric acid at the beginning of the study were predictive of how quickly somebody would lose kidney function. Now, this is an association. We don't know whether there is a causal link, but that's why we are doing the study, to try to see whether by decreasing uric acid actually we can slow down this decline of kidney function. Hopefully, if this is positive, if we have positive findings, we'll have a new intervention. So we'll have a new therapy for kidney complication, but also by trying to understand the mechanisms through which this happens might give us other targets that we can act upon.